All right. Good morning. Good morning, everyone. We are streaming live. And good morning. My name is Dr. Nurse Paul. And today we are going to do a free Next Gen NCLEX class. This show is hosted by AMN Healthcare International under AMN Academy and Aspire RN with Dr. Nurse Paul. So for those who are joining us today, if you can please join me in the comment section. We are going to dissect a case study today. I prepared a good case for all of us. So let me just share this to my social media. All right. Okay. Alrighty. And tell us where you guys are joining from today. All right. Let me just share this to my social media. And hopefully everybody's doing good. I'm streaming live from Houston, Texas. By the way, this is where I live and this is where I'm residing. Uh, and a little congested today. There's a virus going on around. But guys, please join me in the comment section, okay? And we are going to live stream this in my page as well. We are going to um, dissect a case study today, all right? So we do this every month. All right. So AMN Academy and AMN Healthcare International page, they do free live classes every Monday of the month. And I'm doing it every third Monday with them. I'm also streaming this live in my page, Dr. Nurse Paul, in Facebook and in YouTube. All right. 1 second. And guys, if you can just do me a favor and share this to your page so we can reach your friends. We are going to start soon. All right. Okay. So I think more people are still joining. All right. We have Froy watching us from Ontario, Canada. Hi, Froy. Thanks for joining us today. We are about to start. I prepared a case study for all of us today. Faith is joining us from Kenya. Pooja is joining us from Nepal. May is joining us from Montreal, Quebec, Canada, and Annette is joining us from New Brunswick in Canada. Hello, everybody. How about the others? Pam is joining us from Philippines. There we go. Thank you. And please tag your friends. We are about to start. Okay, so again, today we're going to talk about a case study. All right, for our NCLEX. All right, so case study is the new version of the NCLEX. It's called the Next Generation NCLEX, which was implemented last year. All right, April 1st, 2023. Hello, Jeanette. Thanks for watching us all the way from Europe, from Malta. I haven't visited Malta. I want to visit that soon. Vince is joining us from New Zealand. Wow, all the way from New Zealand. What time is it there right now? Thanks for joining. All right. And here, let me share this to my social media page so my followers can also join. Let me see. Okay. So anyway, today we're going to talk about a case study. I prepared a case study for all of us. And I do this again every third Monday of the month. Last time I was here was third Monday of May. And this is our new version for today. We're doing this live. So guys, because this is a case study and this is an NCLEX class, this will be very interactive. Please help me answer the questions. I'm going to be waiting for your answers in the comments. All right. Um, all right. All right. Okay. Froy is already a US nurse and a Canadian nurse, but still watching. Wow. Thank you, Froy. Thank you for the support. Angela is watching us from the Philippines. Okay. All right. So, what is Next Gen NCLEX? Just give you guys an overview. All right. Let me see if I can flash my screen. By the way, today, let me see how do I do that? Oh, I need to open my slides, of course. All right. So today, guys, we are going to get do a raffle. All right. I'm gonna do a little raffle for the live viewers today. there will be one lucky winner of my free NCLEX course. So before we start, if you guys can join our raffle, the QR code is there. We are going to post the link for the raffle to the comment section so you guys can join. And the raffle for this raffle, there will be one winner for today's session for my NCLEX course. All right, so let me post um, the what's this the link to the raffle to the comment section. Here it is. Thank you, AMN. Thank you, Miss Milanis, our moderator today, for posting that. I'm gonna post that as well. All right. So click on that link on your comments right now, or if you have your phones, scan this QR code, and there will be one winner for my NCLEX course worth $550. All right. And we're gonna draw that later if we have time. If not, I'm gonna put it in my Facebook page. But there will be one winner. I did this last time, and last time there were 500 participants in the raffle. Okay, so we're gonna open the raffle right now. We're gonna flash this link again later. All right, and more people are coming in. Hello, War is joining us from Davao City, Philippines. Isha is joining us from Cebu. Thank you for watching. We are streaming this live in AMN Healthcare International page and Dr. Nurse Paul's page. All right. So anyway, like I said, we're going to talk about next gen NCLEX, and then later we're going to do a case study. Okay. So for those who do not know yet, next gen NCLEX is the new version of the NCLEX. So we have 8 main categories for the NCLEX, right? And during the update last year, they increased the pharmacology and safety and infection control category. So these are the 8 categories for the NCLEX. When you review for the NCLEX, these are the 8 categories that you need to review, but all of these are integrated. Okay, so you see, management of care still has the highest chunk, and management of care actually includes ethical legal nursing, disaster nursing, emergency nursing, prioritization, and of course, pharmacology is all your medications. Okay, so those are the biggest chunks for your NCLEX. Minimum items for NCLEX is 85, maximum is 150 items. It's computer adaptive, which means you can stop at any number between 85 to 150 items. And it's because it's computer adaptive, the question depends on your individual ability during the exam. So total exam is 5 hours. You can finish faster or slower. It's really up to you. And item types now for the next gen NCLEX, there are multiple different ways to deliver questions now. So it's not only multiple choice and select all that apply. We also have matrix, which are tables. We're going to show you an example later. Drag and drop questions, drop down boxes or close, highlighting text, bow ties, and case studies. If you've watched my previous shows, you would have seen most of these already because I've used a lot of examples of these different types. If you haven't watched my other shows, you can go to my YouTube, put at Dr. Nurse Paul, and all my free live classes that I've streamed are there in my YouTube channel. So go follow me in YouTube right now. All of my previous classes are there. Okay. All right. How about the others? Where are you guys coming from? Let's acknowledge some of our viewers. If you guys can do me a favor, can you share this show to your pages so we can reach out to your friends? All right. Okay. Wow. So there are more than 100 viewers right now. Ronel is joining us from Harad. All right. So let's continue with the slide. Today we're going to talk about case studies, and I always say this: case studies is in next gen NCLEX, it follows a pattern. We call it the clinical judgment model. There will be 6 questions per case studies. All right, per case study there will be 6 questions. First question would always talk about recognizing cues, your signs and symptoms. Second question would always be about analyzing cues. Third question, prioritizing hypothesis. Fourth question, generating solutions. Fifth question, taking actions. And 6 is evaluating outcomes. So we're going to do the case study in a little bit. All right. Okay. So those are your 6 parts of your case study, and we're going to go through them one by one. So today we're going to do one case study with 6 questions. Let me see how you guys answer this case study. I prepared this for all of you guys. This is original question. I haven't used it for any of my classes yet. Okay. Now, again, for those that just joined us right now, we have a raffle for today's show. I'm giving away an NCLEX course from Aspire RN and Dr. Nurse Paul. And for everyone who doesn't know me, I'm an NCLEX instructor. I've been doing or teaching NCLEX for 17 years already. All right. And my company is called Aspire RN. We have partnered with AMN Healthcare International to provide this show, to sponsor this show. And we do this every third Monday of the month. All right. So for those who are viewing this show today live, you have the advantage of joining the raffle. Okay. We're going to post the link again. All right. All right. So if you can just join us for the raffle. All right. And we're going to draw that winner later. Okay. Last time there were 500 participants last month that joined the raffle. Now is your chance. All right. We have 98% passing rate in Aspire RN, and we do it a little differently. Of course, we do have live classes and question banks in our portal. But more importantly, we do personal mentorships and personal guidance. All right. Something that for me is valuable for international graduates like you and me. I graduated from the Philippines 17 years ago for my BSN. I'm now here in the States. I've been living here for 7 years. And I put up my business here in my home office. And now I'm doing it virtually. I have students all over the world, 40 plus countries. All right. Thank you for everyone who's joining. And if you have a chance, and if you haven't followed me yet, follow me on my social media right there at Dr. Nurse Paul, so you can see latest updates for my free classes, free live Q&As, giveaways, and all that in my page. All right. Thank you. Okay. All right. And Cherry is watching us from UAE. Eric is joining us from Laguna, Philippines. Joanne from Cavite, Philippines. Mitch is from Valenzuela. Froylan is in NSW. Is it what is NSW again? I'm sorry. I think I'm still a little sleepy. All right. I think more people are still joining us. Adrian is joining us from Dublin. Thank you, Adrian, one of my followers who always watch my videos. All right. And Elaine is from Marikina. Jester is from Pampanga, Philippines. Carmi is joining us from Saudi. Anthony is joining us from Kenya. Thank you. Melchor is joining us from Singapore. We are all over the world. Mira is joining us from Australia. For my Australian and Canadian peers, for international graduates like us going to Australia, you still need to take your NCLEX. You need to take your NCLEX. And for Canada, of course, the licensure exam now for Canada since 2015 is the NCLEX. So NCLEX is not only applicable for US, all right? That's what I want to say. It's also applicable for if you're practicing in Canada or if you're an international graduate nurse who wants to practice in Australia, all right? So by taking the NCLEX, you unlock doors to 3 countries, which is US, Canada, and Australia. All right. So for my Australian peers, this might be appropriate for you as well. But pardon me if I mentioned all about American setup, American protocols, but NCLEX is written by American nurses. All right. So even if you're taking the NCLEX for Australia, for example, we're still going to follow the US protocol because that's how the exam was written. Okay. Okay. Because I've got students from Australia too. I've partnered with a company that deploys nurses to Australia. All right. All right. A lot of people from my home country, Philippines. Adrian, thank you. Shout out Dr. Nurse Paul. Done with the raffle registration. I hope and pray I win DNP NCLEX RN review. Thank you. All right. Okay. So without further ado, guys, I guess we're ready for a case study. Please share this to your pages so we can reach out to your friends. And we are about to start our case study for today, right? So for today, let's take the quiz. Are you guys ready? Are you guys ready? Brian, thank you, Brian. Brian said, thank you, Dr. Nurse Paul and Aspire RN. They helped me conquer the NCLEX. Brian, thank you for trusting Aspire RN. Thank you for trusting me and my team. And thank you for still following me. Brian is our NCLEX passer. I appreciate you, Brian. Thanks for dropping in today. And more people are joining us today. All right. So let me see. Okay. Okay. Let's now go to your case study. If everybody's ready, we are about to start with your case study right now. Okay. All right. Here's our case. All right. Let's read this. Our case for today is about Mr. Robert Johnson. All right. So at 10 o'clock, Mr. Robert Johnson was brought to the emergency department by his daughter due to increasing shortness of breath, swelling in his legs, and fatigue over the past week. His daughter reports that Robert had difficulty sleeping flat and has been using multiple pillows to prop himself up. He also complains of frequent episodes of palpitations and a persistent cough. Robert has a history of chronic heart failure, hypertension, and type 2 diabetes. He is currently on a regimen of furosemide, lisinopril, and metformin. His daughter mentions that he has not been very compliant in his low sodium diet. So here's the question. Based on the patient's presentation, click to highlight the priority findings. So in the actual NCLEX, you're just gonna click, all right? You're gonna hover your mouse over it, and it's gonna show us a yellow color. You're gonna click it if that's your answer, okay? But we don't have that ability right now because obviously I'm using a PowerPoint. I underlined the options for you, all right? I underlined the options for you. You tell me which options you are going to choose. But keep in mind that highlighting text in the NCLEX is a right minus wrong question, which means for every incorrect answer that you click, right, you will get a deduction. So somebody asked in the what's this? In the comments, how many priority findings, right? There is no number. You're gonna have to find whatever you think is a priority finding, all right? And by when I say priority finding, not all abnormal findings would need to be prioritized. You just need to prioritize. Remember your ABCD, your airway, breathing, circulation, disability, what needs to be attended to right now, what needs to be treated right now, what needs to be reported to the provider right now. Okay? So what are your answers? Come on. Oh, Tintin, thanks. All right, answers, everybody. Let me just open my protein shake. This is my breakfast. Anyone? How about increasing shortness of breath? Are we going to click that? Yes. How about the swelling in his legs? Are we going to click that? Yes. How about fatigue? Are we going to click that? Yes, that's significant. Fatigue over the past week, right? Difficulty sleeping flat. Are we going to click that? Yes. How about palpitations and a persistent cough? Yes. How about history of chronic heart failure, hypertension, type 2 diabetes? We're not going to click that. Yes, it is significant for the case, but it's talking about history. When you say priority findings, focus on acute findings happening right now. While history is important for the case, it is not part of our priority finding right now. How about furosemide, lisinopril, metformin? Important for the case, not a priority right now. So our answers are, let's see, 1, 2, 3, 4, and 5. Who got 5 points? Easy question. Easy question. Got 5 points? Yes? This is a very easy question. Okay. Okay. All right. We're still waiting for more people to populate their answers. I might be having some streaming issues here. All right. Very good. Okay. Let's now go to question number 2. So that's question number 1, recognizing cues. Let's now go to question number 2. Let's see what happens next. All right. So in question number 2, all right, let's see this. All right. So for the physical exams, people, all right, vital signs, we have 150 over 90. Pulse, we have 90. Respiration, we have 22. Temperature is 37. All right. SpO2, 92% on room air. So I think that SpO2 is a little significant, ain't it? Because it's already 92%. Constitutional, we have fatigue and mildly distressed. For ENT, we have no jugular vein distension, clear mucous membrane. For pulmonary, we have bilateral crackles, mild wheezing, shallow breathing. In cardiovascular, we have irregular heart rhythm, S3 gallop, positive to peating edema, in bilateral lower extremities. So those are significant findings. Gastrointestinal looks normal, soft, non-tender, normal bowel sounds. Neurological looks normal, alert, oriented to person, place, time. Skin, cold, diaphoretic, no rash or lesions are also normal. All right? So that's based on our physical exam. The question now is, based on Robert's presentation and physical exam findings, select the possible differential diagnoses. Select all that apply. All right. So for select all that apply in next gen NCLEX, this will be a right minus wrong question again. Meaning, if you select something that's not part of the answers, or it's not an answer, then you get a deduction. So be careful, because if you click all 7, all right, then you probably are gonna get 0 points, right? Click too much. So don't click too much, all right? Make sure that you're only clicking options that you're sure about. Janet already has an answer. How about the others? I'm waiting for more people to answer this. Alrighty. Anyone else? Rial is watching from Holy Land. Mouse already has an answer. Greggy has an answer. Considering all your signs and symptoms, your patient is short of breath, your patient has persistent cough and palpitations and unable to sleep and fatigued, and now we have these crackles and bipedal edema. What are the possible diagnoses that we have? Anyone? Sorry about that, guys. I still have a little. I've been snotty for the last 3 days. Been very congested. Okay, how about pneumonia? Can we consider pneumonia with bilateral crackles and wheezing, shallow breathing? Yes or no? Yes or no? I think I will include pneumonia in my differential diagnosis. Okay? I will not dismiss pneumonia just because, you know, there's no fever, but I mean, there's still respiratory symptoms, so I will definitely include pneumonia in my differential diagnosis, right? Making sure that we don't have pneumonia. How about asthma? Can we consider asthma exacerbation here? Possibly, because of the wheeze and the crackles. Let's include that. We're not saying that's the diagnosis, but you're doing differential, which means you have to broaden your diagnosis, your analysis, right? We're analyzing the case right now. How about acute coronary syndrome? How about acute coronary syndrome? Acute coronary syndrome is your chest pain from angina, unstable angina, or MI. Yes or no? I think I will include that as well. All right. Why? Um, you're having like cardiac symptoms, right? Irregular heart rate, right? Of course, S3 is CHF. Plus, earlier we have palpitations, all right? We're not going to dismiss acute coronary syndrome. What if it's related to MI and the patient's having heart failure from MI, right? So we're going to include acute coronary syndrome, all right? Remember, when you're doing differential, you want to broaden your analysis, not narrow it down, all right? Because you don't want to miss something. How about renal failure? I don't think this is renal failure, right? Because with renal failure, you will have other symptoms, right? Generalized edema, right? Dry skin from your ureic frost, right? And all that. What else? COPD. Can we include COPD? We have shortness of breath, and we have those Unable to lie down, yes. Yes, let's include COPD. Congestive heart failure, yes, because that's the patient's history. Patient's history, he has CHF, right? So we're going to include that. Sepsis, is this sepsis? If it's sepsis, we should have fever, we should have tachycardia, right? So we have not seen that. So what are the answers, guys? Our answers would be pneumonia. Oh, I did not include asthma, I'm sorry, because it is clearly CHF, right? COPD. Asthma is more for kids, right? And the patient has history of CHF, so it's less likely asthma. But for the purpose of this discussion, we can include asthma because we have wheezing and crackles. Okay, so answer here would be 1, 2, 3, 5, and 6. Okay. Now, in the NGN, you can have partial scores, which means if there are 5 answers, if there are 4 answers, and you've only answered 2 or 3, you still get credit for those. That's what's good with Next Gen NCLEX right now, because you still get partial scores. Okay, so a lot of you guys have answered 3, 4, you still get those credits. The only thing here is if you've answered 4, or 7, then you get a deduction, okay? Because this is right minus wrong, okay? But okay, let's continue using the same case. Number 3, let's prioritize now. Remember, number 3 is prioritizing hypothesis. Okay, so let's see this labs. Now we have new labs for Robert. Anything outstanding for you guys? Find something that looks abnormal. What is abnormal in our labs today? White blood cell looks normal, right? Hemoglobin looks normal to me. Hematocrit, normal. Platelets, normal. Sodium, normal. Potassium, normal, right? Chloride, normal. Bicarbonate, normal. BUN, a little elevated. Creatinine, a little elevated, correct? You see that? Glucose, high. So we have high glucose there. BNP, 800, right? BNP, when that is elevated, there's CHF or CHF exacerbation, right? B natriuretic peptide. Chest x-ray, cardiomegaly, and pulmonary congestion. So we have pleural effusions there, possibly due to the CHF exacerbation, right? There's pulmonary effusions. Echocardiogram. So our cardiac ultrasound or echo is 35%. Our normal is 50%. So now your heart is just pumping 35% of the volume. All right? So reduced cardiac function. Is this CHF? Are these results screaming CHF to you guys? CHF exacerbation? Yes or no? Elevated BNPs, pulmonary congestion, low ejection fraction, yes or no? Are these all signs of CHF? Yes. So based on Robert's assessment, lab findings, and imaging, which of the following indicates that the nurse understood the pathophysiology of CHF? There's only one answer. This will be easy for you guys. So based on the findings, what explains CHF in your options? Anyone? And tag your friends. This is recorded, so this will be available in AMN Healthcare International and Dr. Nurse Pulse pages right after this show. So you guys can still watch this. I know a lot of nurses are working. We have different time zones. So they're probably not here today, but they would want to watch this, especially if they're taking the NCLEX soon. All right, so what's the answer? This is easy. Number one says CHF. In the CHF, the heart compensates by increasing its pumping force, resulting in reduced symptoms over time. That is incorrect. In congestive heart failure, the force of contraction decreases, not increases, right? That's why it's called heart failure. 1 is incorrect. Number 2, in CHF, sodium and water retention by the kidneys help to improve cardiac output. Incorrect, all right? CHF does not affect the kidney. All right, CHF is a thing on its own. So let's remove number 2 because it's talking about the kidney. Number 3, in CHF, the heart's ability to pump blood is compromised, leading to fluid buildup in the lungs and extremities. Is this correct? Is this our answer? Very good. 3 is the answer. How about number 4? Number 4 is incorrect because it says the heart's increased efficiency reduce the need for diuretics. Incorrect. That's why it's called heart failure, because the heart is not pumping correctly, all right, or adequately. Best answer is number 3. That's the only answer. Okay. Now let's go to question number 4. All right. Very good, nurses. Super easy for everybody. We're moving very, very quickly. All right. Number 4. All right. Let's see. Okay. This is question number 4 now. Robert has been started on digoxin. Digoxin, by the way, is a favorite NCLEX question. If I can tell you something that always comes out in the NCLEX, it's digoxin, all right? As part of his CHF management plan, the nurse knows that digoxin works by how? Anyone knows digoxin? We use digoxin for CHF. We can also use it for atrial fibrillation to manage the rate, especially if you have AFib, RVR. But digoxin, you got to monitor this medication carefully because it has a very narrow therapeutic index, all right? Which means the normal value is too narrow, okay? Does anyone know the normal value for digoxin while we're waiting for the answers here? The normal value for, or the therapeutic index value for digoxin is 0.5 to 2.0. I don't have the ability to write right now on the screen, but it's 0.5 to 2.0, okay? 0.5 to 2.0 nanogram per ml, all right? So that's your therapeutic value when you check the blood levels of digoxin, all right? Any more than 2.0 in your bloodstream can cause adverse effects, and digoxin is dangerous, okay? All right. Mai is saying, this is testing my MS knowledge real hard. I'm only an incoming 4th year. Good job, Mai. All right. You're way ahead of your peers, but that's okay. All right. Join more of my classes online. Okay. That will help you with getting through your BSN school. But good for you. I admire your dedication. All right. You can do it. But what is digoxin? Remember, digoxin has positive inotropic effect, which means it increases the force of contraction, but it also has negative chronotropic effect, which means it decreases heart rate. Increases contraction, the force of contraction, but decreases heart rate. Increases the force of contraction. That is what we want for CHF, because in CHF, your heart is not pumping correctly. Agree? Yes or no? Yes? So we need digoxin because it's positive inotrope. It's an inotrope. It can pump the heart. Yes or no? Yes or no? Yes? Yes? However, it can decrease heart rate. So that's just one thing you need to monitor with digoxin. You need to monitor the heart rate, right? Let's answer. So people answered 1, somebody said 2, somebody said 3, somebody said 4. Let's see. Let's go down from 1 to 4. Number 1, decreasing the refractory period of the AV node, which increases conduction through AV node. This is incorrect because remember, digoxin can decrease the heart rate. Decrease the heart rate. It doesn't increase. When you say increase conduction, you are increasing the heart rate, right? Because conduction means contractility, correct? When you conduct the electricity or electrical firing to the muscles will move. Conduct, contract, right? So if you say increasing conductivity, you're also increasing the contractility or the rate. We don't talk about the rate here. I'm sorry, the rate would be decreased, not increased, right? So not increased conduction. So 1 is incorrect. Number 2, increasing intracellular sodium and promoting calcium influx in the heart muscle, increasing myocardial contractility. Does digoxin increase myocardial contractility? Yes or no? That's my question. Does digoxin increase myocardial contractility? Yes or no? Yes or no? I said earlier, positive inotrope, it increases myocardial contractility. I'm sorry. Yes? So 2 is a possible answer. Let's see if we can find more answers. All right. Number 3, Directly dilating, no, it doesn't dilate coronary arteries. All right, number three is incorrect. Number three is incorrect. All right, number four, acting as a beta blocker. Your beta blocker both reduce the contractility and heart rate. It's negative inotrope, negative chronotrope. All right, digoxin is different. It's positive inotrope, forces the contraction. All right, but it decreases the heart rate. So guys, best answer here is number two. All right, it promotes sodium and calcium movement so that your heart keeps pumping, but at the same time, it reduces the heart rate. So best answer is number two. You got it? I mean, even if you don't know the sodium and calcium movement, you see the word increases myocardial contractility. That's your key. Because remember, digoxin is a positive inotrope. Are we clear? All right. And then again, we're going to share one more time the raffle for those who wants to join the raffle. Last call. All right. All right. For the raffle. Okay. I posted the links again, and AMN Healthcare International also posted it in their comment section. Okay. So there will be one winner today. Okay. So best answer here, or the only answer, is actually number two. 1, 2, and 4 are all incorrect. All right. Beta blockers are different. Those are your metoprolols, atenolol, labetalol, carvedilol. Those are different. What they do is reduce the force of contraction. You don't want to give beta blockers with CHF, because in CHF, you want the force of contraction to increase, right? Your ejection fraction is 35. You want it go above 45, above 50, correct? If the heart don't pump correctly, then you get all these fluids retaining in your body. You get congested. Patient gets hypoxic because of all those fluids in the lungs. All right, they can't move. They're fatigued because they're so heavy. Their fluids are retaining in their body, in their legs. So that's what the digoxin is used for, to force the contraction so that the heart keeps pumping and that the blood keeps circulating, right? So you don't get those retentions. All right, next. All right, we're going to, so answer is number two. We're going to number five. All right. Drag and drop the appropriate words to complete the following sentence. The nurse is aware that the potential adverse effects of digoxin therapy are, this is drag and drop. And the actual NCLEX, what you guys are going to do is you're going to drag the word and drop it to the box. But we can do that right now because it's PowerPoint. So give me three answers. Adverse effects of digoxin. So again, the normal value for the digoxin, the therapeutic index, is 0.5 to 2.0. Not more than 2.0 because it will cause these adverse effects. Okay? And this is a favorite NCLEX question. Somebody said bradycardia. Christine, lethargy is not in the option. So focus on the word box. You have a word box. GMAR already provided. GMAR provided their answers. Okay. Okay. All right. How about hyperkalemia? Should we include that? No. All right. All right. Hyperkalemia is not an answer. In fact, digoxin reacts with hypokalemia. When you have hypokalemia, you can have more digoxin toxicity, but digoxin does not necessarily or directly affect the potassium levels. All right. So digoxin does not cause hyper or hypokalemia. It does not cause any of those. All right. However, if you're hypokalemic, low potassium, then you can have more digoxin toxicity because it's like potentiating effect. Both potassium and digoxin can cause cardiac conduction issues, right? Dysrhythmias. So guys, let's remove hyperkalemia. Again, digoxin does not cause potassium issues. It does not cause potassium imbalance. However, if you have hypokalemia and you're taking digoxin, you can have dysrhythmias, all right? Dangerous combination. Vomiting, yes, that's one of the earliest signs. Vomiting, abdominal pain, right? Nausea. Bradycardia, yes. Did I mention earlier that it is negative chronotropic, which means it can reduce heart rate? Yes or no? It can reduce heart rate, correct? So yes, bradycardia, yes. And halos around lights, yes, that's the NCLEX favorite question. halos around lights, all right? Or visual changes, visual disturbances, blurring of vision, right? Halos around lights, okay? That's your favorite in the NCLEX. So we got our three answers. Hypertension is incorrect. Digoxin does not cause hypertension. It increases the force of contraction, but it does not increase the blood pressure, okay? You got it? So vomiting, bradycardia, and halos around lights. So got 3 points. The good thing with drop down or drag and drop questions, there's no penalty for incorrect answers. There's no deduction. All right. So if you only get 2 out of 3, you get 2 points. If you only got 1 out of 3, then you get 1 point. All right. All right, and monitor for bradycardia. The vomiting, bradycardia, and halos around lights are popular in the NCLEX, especially with the digoxin, okay? So with bradycardia, do we need to monitor the heart rate, apical pulse for 1 full minute? Yes or no? Before giving the digoxin, yes or no? Yes or no? Yes? Yes? Yes, because it can cause bradycardia. Don't give it if the heart rate is less than 60, all right? Verify first, correct? All right. Another thing, right? Do you know the antidote? What if the patient is on the digoxin and now the patient is vomiting? Patient complains of halos around lights. Heart rate is now 40s. Patient is now disoriented. What's the antidote for the digoxin? Anyone? Anyone? Antidote for the digoxin. It's what? Digibind, all right? Or Digifab. Digoxin immune F antibody or Digifab. The brand name is Digibind. So everybody knows it as Digibind. That's good. So we start giving Digibind if the patient reaches a toxic level of digoxin or is manifesting all these side effects. All right. So very important to monitor patient while taking digoxin. All right. Okay. All right. Last question for the day. Woohoo, very good, guys. All right. Okay, so same situation, nothing changed with their situation, guys. But let's see, the nurse is evaluating Robert's progress. Which of the following findings indicate that Robert is ready for discharge? So like all that apply. Remember that question number 6 in Next Gen NCLEX is always about evaluating outcomes. All right, so let's see if Robert improved. What would indicate that he's ready for discharge? Go. And remember that select all that apply is right minus wrong, okay? So if you click something incorrectly, you get a deduction. Be careful. I'm gonna wait for your answers, guys, and let's see if we can find the raffle. Okay, what's your answers? So there are 8 options right now. All right, so we have 133 entries today. Very good. I'm about to close the raffle, guys. We are about to draw the winner soon. Alrighty. Okay, I'm trying to copy the names here already. Let's see. We have 133 entries. Okay, perfect. Okay, let's see. So improved exercise tolerance, yes. Decreased peripheral edema, yes. No? Yes? Decreased peripheral edema means your blood circulation is doing good, right? Your heart is pumping your blood very well. So we're gonna include that. If you still have edema, then your CHF is not getting better; it's getting worse, right? Heart rate consistently above 100. No, that's not a good indicator. All right, we need the heart rate to be normal, not too high, because you're gonna get fatigued, right? There's gonna be an increased cardiac demand. We don't want that for the heart. No episodes of dyspnea, shortness of breath. Yes, we want that. That's a good indicator, which means there's no more pulmonary congestion. Weight gain of 5 pounds over a week. We don't like weight gain of 5 pounds over a week, guys. It means fluid retention, right? And if there's fluid retention, your CHF is not getting better, Mr. Robert. Clear lung sounds and auscultation. Yes, which means pulmonary congestion has been relieved. Blood pressure consistently high. No, we don't want that. Patient reports less fatigue. Yes? Okay. Yes. So the answers are 1, 2, 4, 6, and 8. 5 points. Who got 5 points? Who got 5 points? Anyone got 5 points? All right. Okay. So I'm preparing the. I, okay. Preparing the thing here. Okay, we're gonna do that later. Okay, very good. Okay, so now we're gonna go to the raffle part. Let's wrap it up. Thank you guys for joining, and of course, I want to take this chance to promote Aspire RN Dr. Nurse Paul method. We use the Dr. Nurse Paul method, 98% pass rates. We do next gen NCLEX case studies like this during our class. We do personal mentorships. You will be assigned to your own personal student advisor and mentor to make sure you're properly guided to prepare for the NCLEX. And that is what we brag about because we really take good care of our students. All right. And of course, when you enroll with Aspire RN, you have the Dr. Nurse Paul guarantee, which means I will make sure that you will pass the NCLEX 100% guaranteed. Or if you don't make it, assuming you don't make it, right? I'm going to review you again for free. All right. We're going to do that again for free until you pass. Hopefully, it's only one take. We've got great success with our students from all over the world, 40 plus countries. All right. You can look at our website and our Facebook page for more information about our students. All right. We have three main courses: full, rapid, and crash course. Crash course are for those students that only need a month of review. This is 10-day live class and a lot more hours and hours of other recorded classes as well. But 10-day live class Q&A, we call it the HIT class, which means high impact tutoring. That's 10 days, a month prior to your exam. Now, if you have plenty of time, you're still applying for eligibility, you want to do the full course. Full course has everything. You get full mentorship with that, all right? You get your mentors to guide you past the NCLEX. You join 42 different live classes. That's unlimited for 1 year or until you pass. All right. And regular price is usually $550, but we're offering it 30% off. I think this is 30% off. For international nurses, we're offering it $400. And for Filipino nurses, to my peers in Filipino, it's 19,999 pesos for the full course. All right. For the crash course, we're slashing it down from, I think this is $250 or something around 12,000, 13,000 pesos. It's going to be 7,999 only, all right? Limited slots only. We don't admit many students per month. We have limit. That way we can just focus on make sure that everybody's getting personal mentor. Our next class will begin on early July. I think that will be first Monday of July. So reserve your slot now. All right. And this promo is limited seats only. I think there's only 20 seats that are open for this particular promo. Okay. And that's it. And if you're thinking, can you pass the NCLEX? Of course, yes, you can. I believe in the power of positivity and optimism. Somebody's asking, can we do an NP prep class, please? Or please do an NP prep exam, exam prep. Probably in the future. But are you guys ready for the promo? I mean, for the raffle? Are you guys ready for the raffle? Let's see, raffle. What date is it today? June 17. All right. Okay. I'm going to share my screen, another screen. And let's see if I can share this so we can draw the winner. All right. Okay. We are about to draw the winner for today. I got a little hiccup in the background because I have to copy the names and paste it. All your names are there. There are a lot of entries there. Oops, 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 oops. Okay, all the names are there. And let's click the spin. And the winner. Ian Carlo Anastasio. Congratulations, Ian. Please message me and Dr. Nurse Paul so I can walk you through how to claim your prize. And thank you so much for everybody who joined. We will be doing this again next on July, third Monday of July. I do this every third Monday. So please join me. Follow me on my social medias right here at Dr. Nurse Paul so you can find out my latest events, my live Q&A on June 26th. It's a Wednesday. I'll do a live Q&A for my followers, and there will be another raffle in that live Q&A. You can ask me questions about NCLEX, application for NCLEX, preparation for NCLEX, visas to go to the US, how to find your job in the US, how to find an employer, how to get into NP school, what do I do to become a nurse practitioner or to become an RN, what certifications. I will answer everything that I can for 1 hour in my social media pages, Facebook and TikTok at Dr. Nurse Paul. See you on June 26th for my live Q&A. Follow me for more information. And thank you guys. Thank you AMN Healthcare International for hosting this show. I'll see you guys in our future shows. Bye now.